Medicalization refers to the process by which non-medical problems or behaviors become defined and treated as medical issues, often through the lens of diagnosis, intervention, or prevention. This sociological concept highlights how certain aspects of human life, once considered normal or natural, are redefined in terms of health and illness. Medicalization has profound implications for individuals, society, and the medical profession, shaping perceptions, behaviors, and systems of care. The origins of medicalization are closely linked to the expansion of medical authority in the 19th and 20th centuries. As medicine advanced, conditions previously understood as moral or social issues, such as mental illness, addiction, or childbirth, became reinterpreted as medical problems. For instance, childbirth, once managed by midwives as a natural life event, transitioned to being heavily medicalized, with obstetricians and hospitals becoming the primary authorities. Similarly, alcoholism was historically viewed as a moral failing, but is now classified as a medical condition under the term alcohol use disorder, leading to treatments involving medications and behavioral therapies. Key drivers of medicalization include the professionalization of medicine, the growing influence of pharmaceutical companies, and changing societal attitudes toward health and well-being. The rise of psychiatry has been a significant contributor, as it expanded diagnostic categories to include conditions such as anxiety, depression, and PTSD. For example, grief, once seen as a normal response to loss, has been partially medicalized with the inclusion of prolonged grief disorder in the DSM-5 Diagnostic and Statistical Manual of Mental Disorders. The consequences of medicalization are multifaceted, affecting individuals and broader societal structures. On one hand, medicalization can lead to improved awareness, funding, and treatment options for conditions, reducing stigma and enhancing quality of life. For example, the recognition of autism spectrum disorder as a medical condition has increased understanding, early interventions, and support systems for individuals and families. Similarly, the medicalization of mental health has encouraged more open discussions, reducing taboos surrounding therapy and psychiatric care. On the other hand, critics argue that medicalization can pathologize normal variations in human experience, creating dependency on medical systems and pharmaceuticals. The rising use of psychotropic medications for conditions like mild anxiety or insomnia raises concerns about over-reliance on drugs when lifestyle changes or psychotherapy might suffice. The medicalization of aging provides another example, with treatments like Botox, hormone replacement therapy, and anti-aging surgeries framing natural aging as a problem requiring medical correction rather than a normal life stage. The role of the pharmaceutical and medical device industries in driving medicalization is significant. Marketing campaigns often redefine everyday experiences as medical problems to promote new treatments. For example, the condition restless leg syndrome gained widespread recognition largely due to pharmaceutical advertising, leading to an increase in diagnoses and prescriptions. Similarly, direct-to-consumer advertising for medications like Viagra has played a central role in normalizing erectile dysfunction as a widespread medical issue. The influence of industry also extends to diagnostic guidelines, with some arguing that criteria for conditions like ADHD or hypertension have been broadened to expand markets for drugs. Lowering the threshold for diagnosing high blood pressure, for instance, has brought millions more into the category of patients, many of whom may not require medication but now seek treatment. In response to concerns about over-medicalization, de-medicalization seeks to redefine certain conditions or behaviors as non-medical. Efforts to promote natural childbirth and reduce the prevalence of cesarean sections exemplify this trend. Campaigns to challenge the overdiagnosis of ADHD, particularly in children, highlight the importance of considering alternative explanations for behavioral issues, such as educational or social factors. The field of mental health has also seen efforts to reclaim certain experiences as natural. For example, campaigns promoting the idea that unhappiness or stress is not necessarily a psychiatric disorder, but a normal response to life challenges aim to reduce the medicalization of emotional distress. Similarly, movements emphasizing body positivity challenge the medicalization of obesity and call for a shift toward addressing its social and environmental determinants rather than exclusively focusing on weight loss medications or surgeries. Medicalization reflects the evolving relationship between medicine and society, influencing how individuals and cultures understand health, illness, and the human condition. While it has undoubtedly advanced care and reduced stigma in many areas, it also raises critical questions about the limits of medicine and the commodification of health. For instance, while medicalizing mental health has brought much needed resources, it risks overdiagnosing normal emotional states, blurring the line between health and illness. Balancing the benefits of medical interventions with the risks of pathologizing normal human experiences remains an ongoing challenge. A nuanced approach is needed, one that recognizes the value of medical advances while remaining vigilant against the expansion of medicine into areas better addressed through social, cultural, or personal frameworks. As society continues to grapple with these issues, it becomes increasingly important to critically evaluate the forces driving medicalization and to ensure that the process serves the best interests of individuals and communities. Stay tuned for more insights into business and the social sciences. If you found this overview helpful, don't forget to like, subscribe, and comment on future topics you'd like us to cover. I'm Dr. Dag, wishing you a fantastic day ahead.